Hello, everyone, and welcome to today's panel discussion, COVID-19 and the Built Environment. My name is Janelle Penny. I'm the Editor-in-Chief of Buildings Media, and I'm very pleased to welcome you to this course today. I'd like to begin today by thanking our sponsors, Chicago Faucets and Powering America. Please visit their websites. Before we get started, I'd like to conduct a brief polling question. Please enter the total number of people watching this course and make sure to include yourself in that number. To answer the question, just select your response and then click Submit. Thank you. We encourage you to ask questions during the presentation. If you'd like to ask a question, just click on the Q&A icon at the bottom of your screen. You can submit questions at any time, but most questions will be answered at the end of the presentation during the Q&A session. Should you experience any technical or audio difficulties during this broadcast, please send a message in the Q&A box or contact us at 1-800-553-8878. On behalf of Staymates Communications and Buildings, we're pleased to announce today's course is worth 1 hour of credit with the AIA for continued education. Here you can find our provider number as well as the course number. It is also approved for 1 CPD credit from BOMA International for RPA, FMA, or SMA designation programs, as well as 1 BOC maintenance point toward credential maintenance. Following the course today, you'll be redirected to the Buildings Education site where you can submit for credit. Note, though, that you must be present for the entire course to gain credit. Before I introduce our speakers, I'd like to take a moment to review our learning objectives for today. They are to understand how COVID-19 has impacted the design, delivery, and operation of buildings so far, hear how people in the industry are adjusting, learn some examples of how people in the industry have come together to assist each other and or their tenants, and gain some ideas for how to respond to future challenges. And now I'm pleased to introduce our panel of experts. Joining me today are Jenny Hahn, Cameron Scott, Joe Markling, and Brenda Bush-Moline. Jenny Hahn is a licensed architect with 25 years of experience. She oversees Skinder's modular architecture and design for healthcare projects. In her role as Director of Healthcare Design, she manages day-to-day design administration, including staffing, budgeting, and planning. Previously, Jenny led on-site design teams for capital projects at Rush University Medical Center, where she supervised program management and design for a wide variety of campus-wide initiatives. She also consulted with Rush to provide a rapid response during the 2014 to 2016 Ebola outbreak and to create a biosafety level 3 laboratory. Cameron Scott leads a global team managing service delivery to more than 500 clients through digitally enabled processes that leverage JLL's global scale and specialist talent to optimize the performance of dedicated account teams and variable resources. The team's capabilities include facilities management, experience services, engineering and maintenance services, and energy and sustainability services. Cameron has more than 20 years of experience in facility management outsourcing and real estate services, working with clients and service teams across a diverse portfolio. Joe Markling is the Managing Director and Head of Real Estate Operations for USAA Real Estate. He leads a team at USAA that is responsible for providing property management operational support for the office, industrial, retail, and multifamily properties nationwide owned by USAA Real Estate. He is the past chair and CEO of BOMA International and is a BOMA Fellow. And Brenda Bush-Moline is a healthcare leader with more than 25 years of experience. She's responsible for inspired and energized service for healthcare clients to create places of healing and wellness. By focusing our efforts on integrated health design that considers related markets such as workplace, hospitality, retail, and education, Brenda has supported the national development of reimagined care models. Through active listening and engagement, she translates design and planning intentions into spaces that reflect the mission and vision of her clients. A LEED AP certified professional, Brenda also holds certifications from the American Institute of Architects, the American College of Healthcare Architects, and the Economic Developers Association of Canada. And with that, I'd like to extend a warm welcome to our speakers. Welcome, everyone.
Thank you.
Thanks for having us.
Here.
Audience, you can submit questions for the panel in the Q&A box. We will answer questions throughout the webinar. Let's get started. So panel, we know it's relatively early in this outbreak and there are a lot of unknowns, but One thing is for sure, is the way we design, deliver, and manage buildings is changing very quickly. So how have you noticed things changing for the better in building design and management? Joe, why don't we start with you?
Well, we just here at USA Real Estate completely redid our space about 2 years ago now, and we condensed quite a bit, but we also, I think, saw and our people felt like some of the options that we had were very, very close quarters, and we opted for a little more distance, which now feels a lot better. So I'm not sure that things are going to change. I think that people felt very spread apart and had plenty of social distance, if you will, the new term, before we all went home to work. I think when they come back, they're probably going to feel a little closer than they actually are and might be a little more concerned with some of that. The furniture that we have works well. It's the larger scale cubicles and those kind of things. But I just think people are going to be a little more, I don't know, they're going to feel closer together than they actually are. So I think down the road, there might be a little, I'm thinking there might be a little less of the packing people in like we've been trying to do the last 4 or 5 years, and maybe a switch to a little more distance, a little larger cube, something like that going down the road.
Great. Jenny, what are you noticing?
Well, I think it is, in fact, too early to say, in particular with healthcare design. We have been, sorry, is this, are you doing okay? We have historically, in the building and design world, reacted with broad sweeps and changing code, which is something that I think that we're going to be expecting. The fact that we're having very frequent conversations with all of our authorities having jurisdiction all the way up and down because of the rapid response that is needed to address the timelines that we're seeing in an unprecedented fashion. We're compressing these conversations and in some cases overlooking some of the code compliance constraints timing-wise that we normally wouldn't see. But that is to get ahead of flattening the curve. And so I think in the longer term, we're definitely going to be addressing code compliance issues and the ability to flex and respond to pandemics like this, and to have off-the-shelf solutions to respond to whatever is the need, and to look at it at a federal level and dole out what makes sense to each municipality. So I expect that also in the healthcare world, where we have, at least in the US, been experiencing this trend of minimizing beds as opposed to increasing beds capacity across the country. We're going to be having a second look at how to flex on the number of beds to respond to something like this.
Great. Cameron, what are you noticing?
I'd just like to say hello to everybody. I'm coming to you from Sydney, where it's 3 a.m. in the morning. I believe that's the new normal. So I'll just keep it very brief. Yeah, I think the focus is very much in terms of managing and our building has really been around our duty of care to the health and well-being of our people. All employees have that obligation. As an industry, we need to reimagine how we're going to design and manage buildings in the future, and I see signs of that happening. And really, our objective should be to be more operationally resilient in the future, because we may have to deal with similar global crises like these in the future.
What about you, Brenda?
Well, I'm grateful for the inputs that I'm hearing from Joe, Cameron, and Jenny. And really to that point, Jenny's note about compressed conversations, that has been the absolute world for the last at least 4 weeks, going on 5. and the sort of immediate integration and the raising up of voices. And, you know, it's really what sort of Cameron's saying, this reimagine is happening, you know, on our feet, boots on the ground where we can, and then thought leadership globally within Stantec coming to bear. And our workplace, to Joe's point, is very different, and I think it'll continue to be different as we return. But what we're seeing is that because of the way that our professionals are so interested in the future, that those ideas are being brought forward really boldly and in ways that we might not have done before, because maybe we had to go through some processes that maybe Jenny notes about regulatory, or that maybe we thought we had to go through some channels that maybe no longer need to be so existent, and that we have an opportunity now to try new things, do beta tests quickly, see if they work, and when they do, celebrate them and keep moving. So it's exciting and exhausting.
Absolutely. Speaking of some of these changes, have you noticed any examples of people in the buildings industry coming together or helping each other or their tenants in new ways that maybe wouldn't have been done before?
I'd like to comment on what I'm seeing as today's new heroes. First off, that we all recognize the front lines of healthcare workers and the importance of what they're doing and putting their lives at risk, but that our truckers, our cash register folks, our janitorial staff, our lab techs and nurses, they are now also the front line and essential workers and sort of the new heroes. So in terms of how we deliver care for our buildings, they're really the ones who are continuing to step up. But I'm really heartened and pleased to see so many people just looking for ways to contribute. And I'm seeing a lot of our design and construction colleagues stepping up by using their 3D printers to create face shields. As soon as there's a call for another PPE product, our designers are stepping up and looking for ways to redirect our resources. And one other thing about sort of these compressed conversations that is really nice to see in the industry is this open sourcing of information so that we can share the solutions quickly and as broadly as possible. So where we had 3D masks that were taking hours to print, where we've whittled that down to minutes and have been able to address these needs in short order as a design industry.
Yeah, I'll take a stab at that too. From a financial side, you know, the networking is amazing. I'm part of a BOMA National Advisory Council, which is industry investor peers in the industry. And while we, and I know all of my investor colleagues, are trying to take a very compassionate view of rent relief, if you will, as tenants ask for it, we're also a fiduciary and we have to qualify that relief as actually necessary. And so we're starting to have a somewhat an informal dialogue amongst us as, okay, how much your percentage of the rent is being paid in your office portfolio, industrial, where are we getting, you know, the least amount of rent paid? Who are the national tenants that are just basically saying we're not going to pay? Who's fishing for rent relief? Who's serious? We're sharing information that ordinarily, in my 40 years of doing this, is usually nobody tells anybody anything, and we're sharing now and we're talking now so that we can all understand what's going on, because most of us have been in this business a long time. We've never gone through anything like this before, and I'm very heartened at the walls coming down again, even among friends who are in the business together, sharing that information to make sure that we're doing the right thing in a very delicate balance between our fiduciary responsibility to our investors and the responsibility we have to be caring and compassionate to those tenants out there who actually are struggling and actually may need some help from us as far as rent relief.
I've seen lots of examples of the industry coming together, as our other panelists are saying. You know, sharing information has been very willing across industries, across clients, and even to some extent across service providers. Joe, you mentioned about rent relief. In Australia, the government has asked landlords and tenants to come together to reach an accommodation around that, which I think is really a positive move. There's a great client example I can think of. Our client Delta had to move out of their office space. So our team worked with Delta to put them into a hangar, which was part of their museum, so that they could provide their reservation staff could operate with a larger social distancing between them. So there's a great photograph of the team there with the plane wing over the top of their operation.
Yeah, I've seen that. I was fascinated when I.
Oh, you saw that, did you, Jeff? Very good.
I did, and I was fascinated. I had to look at it and go, "What is going on here?" But it was a very fascinating story.
Yeah, I think it might have made its way to LinkedIn.
Great. Brenda, have you noticed any examples of folks coming together or helping each other?
Well, I think my fellow panelists have outlined a lot of them. I think the other side of this is sort of when to step back and sort of know when to get out of the way and in that way help each other as well, because there's a lot of very fast moving engagements going, and sometimes everyone wants to be involved very immediately. And so having those folks who are strategic saying, either hold your fire, hold on, we need you for later, we need you to be resilient, or jump in, go, and then provide release to teams is really important. The other thing is that I'm sure, like many of you, we're trying to information share immediately across our networks. So trying to figure out how to best get information out of teams that are ongoing in their challenges, and then redirect that and communicate that effectively to other teams, so we're not disrupting the work that's happening, but creating that feedback loop. And that's sort of another latent way that we're trying to help each other, sometimes by simple triaging.
Absolutely. How do you find that people in the industry are adjusting and finding a new normal? And let's start with our own organizations on that. How has the COVID-19 outbreak affected your day-to-day operations?
Well, I can start with regard to Stantec. You know, as a global organization, and I can appreciate, Cameron, your time zone, we're often pressing on our team members to, be up at night or early mornings, evenings. And our team has been even more resilient in that way because we're sharing information. So the whole sort of move to home for everyone now, except for a few from time to time, has been amazingly smooth. And I really credit that. And I'm sure you all have amazing IT staff who are underappreciated, just like our essential workers are underappreciated right now. So real important shout out to them and that support. And I think that everyone is, like I am. I've got 2 teenagers and 2 dogs, and honestly, the dogs are more of a problem than anything because they're just demanding and aren't reasonable. So the adjustments that people are making when they hear a dog bark, when they hear the garbage truck come by, or whatever, is really outstanding at a very human level. And then at a personal level, again, to each other professionally, just very acknowledging of when people need something. So this idea that we've mobilized immediately to a work from home status and haven't missed a beat is really an incredible, we should really shout out to our whole industry for doing that, because it's not just firm by firm, it's our entire industry who's done it.
Interesting. Joe?
Yeah, we here in San Antonio, Texas, it's a little different than some of the bigger cities, but we're a subsidiary, or at least I say until last week, we were a subsidiary of USAA. We're now an independently executive-owned company. So we were doing that in the middle of an executive buyout of our company in the middle of this whole thing. So that was interesting. But the week before we actually all went home, we kind of knew we had a business continuity team in place already that was designed around the inability to occupy our space here. And we had a plan within 48 hours, we could be up and running at an alternate location, all that. Well, that plan was worthless because there was no alternate location. So we immediately sat down. I think there were 6 of us with IT and everyone. It's okay, how do we do this? And the first question was, well, who doesn't have a laptop? And we realized there were we have 250 people in this office, and we realized there were about 50 people that didn't because they didn't travel, they never worked remotely. So we got on the phone and I think got the last 50 or 60 tablet laptops within San Antonio and Austin, and keyboards and all kinds of things. And we knew we were probably closing down on Friday, and this was Monday. So we sent everybody home. I sent my team home Thursday afternoon and said, if you don't have a printer, get on Amazon, buy one, buy extra cartridges, take 2 reams of paper, get home, get set up, and I want an email from you on Thursday telling me Friday morning you're ready to go. So we sat down and got really, really pragmatic about it, because we knew people were going to feel very alone. Some of us, like myself, who's worked at home before, who traveled all the time, I am so used to working in hotel rooms and doing stuff like this. It's second nature to me. I'd say 70% of our workforce has never dialed into VPN, didn't even know what it meant, didn't really understand how to work without 3 monitors hanging off your cubicle, and how to use the trackpad. I mean, it was those kind of personal things that was creating a lot of fear in people. So we went around and worked through people. And I would say by Tuesday afternoon of our first week at home, everybody, all the teams reported in that everybody was doing really good. So one, I think the pragmatic technical approach to being ready to leave, and then thinking about the human element of the people who were least equipped to work from home. We've never done it before. Us road warriors, this is like nothing for us. We feel there was a lot of people, we think 70% of our people that really were not technically or emotionally capable of understanding how to do that. And so it's been very successful. My colleagues in the industry and my network pretty much did the same thing. There were a couple of people that said, well, we were totally not ready for this, and it took them a week to get up to speed. I think it took us a day.
Great. Cameron, how about you? How are things changing on your end?
Oh, well, I guess the new normal is still defining itself. So we're kind of in this period of probably an interim new normal before we get to the reimagined world. Certainly in JLL, remote working became a pretty much a standard operating procedure across the world. So we had more than 70% of our office teams or workplace teams working from home. That was 10 days ago, could be even higher than that now. So, you know, the leadership has been engaged globally, working around the clock and working out how to work around the clock. So, for example, there's a global group where there's 3 leaders, and I'm one of them, and we keep our COVID response going out of the 3 regions, and so we follow the sun, manage in a follow the sun way in order to keep the momentum going, because I think, as we're all saying, there's a huge amount of activity happening here. In terms of servicing clients, we're having to adapt our services. We're having to do that very rapidly. And a lot of our efforts right now are starting to focus around the re-entry. We kind of rushed out to work from home and other remote working arrangements. I think getting back, we've got clients with hundreds of thousands of employees. They've got to get back into their workplaces. So there's a lot, if you start to think about it, there's a lot of things that you need to consider around that.
Great. Jenny?
So Skender is a little more unique in the Chicagoland area. We are design, manufacturing, and construction. And it's a company that's been focusing on lean culture and processes for some time now. So there's been an effort to go digital and go cloud for some years. So we have the benefit of being able to send our design teams and our business teams home immediately. And so what's been really good has been leveraging. I'm getting feedback. Is everybody hear me okay? Okay. Is being able to leverage the cloud-based software, and being able to keep in touch like that, and using Zoom, of course. We're sort of Zoom users for several years, and being able to share screen and as designers coordinate that way has been sort of a continual effort. The thing that is sort of more unique in what's been happening lately is just that we do have, similar to, I'm sure, Brenda, a lot of healthcare clients with various needs, and it's been all hands on deck. So not only has it been a day-to-day communication about what the needs are, but it's stepping up by sourcing and donating PPE. In Chicago and Illinois, construction is still considered essential. So evaluating on a day-to-day basis how our work sites are safe, and enhancing the operations there for not only social distancing, but enhanced sanitation and safety. The good thing about construction is that safety has always been of high focus, but it's just sort of shifting that focus to infection control more so than some of the other hazards that they're used to.
Jenny, picking up on that, I appreciate you bringing up the whole infection prevention and infection control, because I think increasingly our teams may even find themselves on site in healthcare environments even after we've hit the peak, you know, of all of this across the nation, which is rolling, you know, differently. But they might find themselves in places where they have to do assessments or site reviews, et cetera, where they're in compromised situations. So that whole PPE piece is a place I'm sure you all are focusing at Skender, and we absolutely are at Stantec, because safety is so critical to us.
That leads into my next question. How have you seen this new normal affecting other people in the industry? Have you noticed anyone coming up with creative solutions, like Cameron, for example, the Delta example that you mentioned?
Yeah, I mean, I think there's been I've seen a great variation in people's reactions to this whole situation. I mean, our employees in China, for example, are very happy right now because they're actually going back to work, and they're very happy to be back in the workplace. So some people see this whole thing as a existential threat, something that they have to defend furiously against. Other people are take a much more, I guess, open and creative approach. You know, what can I do to change my business model? Think outside the real estate box. So, you know, I think, you know, those people are really, they're the ones that will change our industry. Well, I mean, we will get through this. It's just a matter of time. And, you know, the people who are a bit more open and creative are thinking about, how do we design the space? You know, how do we social distance or professional distance in the workplace? How we design around that? What technology do we need to support it? So a lot of these things, and sustainability, I think, will come to the fore as well. So in all of these areas, I think they're being accelerated and will be accelerated by the whole crisis. So a lot of things that we would have never done before, we're going to now do, and a lot of things we plan to do, we're now already doing or will do. So there's a lot, I think there's a lot of positives that will come eventually out of this, just a bit hard to see that right now.
I'd like to add on this idea that we're doing things differently than we're used to. And I think that some of the outcome of this whole experience is that people who have been innovative or have the ability to flex will be able to come up with new solutions and adjust to what we think the new normal is going to be. At Skender, a lot of our focus over the past 2 years has been modular execution of buildings, and that's something that we're in very active discussions with on every level based on where the hotspots are in the US, being able to deploy healthcare spaces quickly and in a more robust manner than the initial response of sort of MASH tents and drive-through testing. So looking at what it means to have ICUs off-site in a parking lot, or as an extension of a hospital system. These are all things that we've been sort of imagining and going through design exercises on that really now is being asked to deploy by us and our colleagues across the nation and the world, looking at modular solutions that are able to be deployed quickly and uniformly and sort of in a more robust, safe way.
Great. Do we have a sense yet of the economic impact this outbreak could have?
You know, that's a really good question. We're looking at that. Obviously, the federal government with $2 trillion and probably more of stimulus, if you will, money injected into the economy here in the U.S. Definitely is going to help GDP, if you will, and help it from a free fall to a smaller, slide down, if you will. The whole idea was to put cash in people's hands so that they can buy groceries, can keep our consumer-based economy growing. The general consensus that I'm hearing and feeling internally and externally is that if we can get this, most of the country anyway, back somewhat moving again by midsummer, we could have a fairly quick turnaround. The discussion I had with a colleague yesterday was this recession isn't based on an oversupply of space or a credit crisis or anything else. We were doing well, and we just have to get the motor started again, and we should hopefully be able to pick back up where we left off. We know that we're still talking. We've consummated several real estate transactions in the last 2 weeks that people are still moving forward because they don't see this as a traditional recession that will last 18, 36 months. They see it as 6 to 12 months, and most real estate delivers, even these days, tenant improvements. You sign a lease today, it's long gone are the days of you move in 60 days. It's you move in 6 months or more. So I'm feeling like the general consensus is we should see a fairly big, fairly quick turn back around. The question in my mind and others is, what is the lag effect of the $2 or more trillion deficit, if you will? That money, just didn't invent itself. Well, it kind of did, but that may help us recover quickly, but that's still a big car payment hanging out there for quite a long time, and it's going to take some time to work itself out.
Absolutely. How will buildings or the ways we deliver services be different going forward? Brenda, would you like to start us off?
Sure. Thinking of it maybe at a couple of levels, maybe it's a strategic and maybe operations levels, because I'm sure my colleagues have thoughts about that as well as the tactical. In health, there are a lot of important stakeholders. And I think, as I'll speak sort of from an architect point of view, master planning, conceptual development of projects, there's a lot of time, and we sort of put it under a discovery or visioning phase. There's a lot of time spent in that category. And it's important time because we're building consensus, we're trying to figure out, the impacts, the potentials, and all of that. But a lot of times there are, unfortunately, and maybe we're seeing an upside to this, there just happen to be silos, or there happen to be places of interest, et cetera. And going forward, my hope is, because we've had, and it's really what Jenny said at the beginning, this, sort of quick immersion and conversation, that because maybe we got used to those silos being relieved a little bit, that maybe this idea of integration around strategy, operations, finance, and built environment can blend, and that we can see our way clear to get a vision clear and have a clear question we're trying to answer that has built environment and operational solutions that can be more effective and brought to bear more quickly. That's a hope, and that's an aspirational goal that I have.
And I'd like to piggyback off of that, because and at a more granular level, healthcare has been sort of, at least in the US, trending towards the neighborhood accessibility and sort of more wellness and less beds. And there have been few hospital patient towers that have gone up in the past 10 years. And so there are certain examples of institutions like Rush University Medical Center, I'm more familiar with, that built in the ability to surge and to isolate in response to the perceived need to be prepared for a pandemic like this. So, and that happens kind of like what Brenda was saying, at a very early stage, and that kind of commitment for healthcare systems to sort of support that financially as an initial investment to separate sort of sections of the hospital so that ultimately they can shift and surge to isolate large numbers of patients, or to use open spaces for an expansion of their emergency department for these kinds of scenarios. But also, I think that going forward, we're going to need to spend more time simulating those kinds of responses across the whole healthcare system across the nation, because clearly many people, many organizations might have gotten caught unprepared because they didn't have the ability to do these things with their infrastructure. And then on top of that, there's a massive collaboration that happens on a day-to-day level with hospitals, because there are so many different stakeholders, from your healthcare providers to your transport people to your pharmacists to your clinical engineering folks. I mean, they all sort of function in concert. And if you don't really sort of simulate these scenarios, you're going to miss something and sort of just be less prepared. The other thing that that has been a trend is that we're starting to envision and understand, and this is just coming out in the news these days, that there's this massive inequity or disparity with sort of, especially in Chicago, who is suffering from this virus and why. And a lot of that has to do with limited access to healthcare or pre-existing conditions because of things like poverty and other demographic concerns. So one of those things has to do with housing. And that's going to be one of the aspects of our industry that's going to have to be part of the solution coming forward, because of these massive numbers of folks that are going on unemployment and who might have been sort of hovering over the poverty line, but then sort of just fell below it. So housing as healthcare is going to be a conversation that's going to be sort of more common in the months to come.
Very good.
Brenda, I like what you said about more increased collaboration and integration. And I think that's something that we're seeing maybe happen at a community level or at a personal level, as well as a business level in this crisis. So it'd be nice to think that can continue. A lot of the collaboration, I think, is going to be enabled by technology, because we're all learning how to use technology to be able to do that. And of course, when the restrictions go off, we'll be able to have a lot less social distancing. So if you combine those two things, I think it could be, and I'm hoping it'll be an ongoing and positive development.
Great. What are we learning now that will position us better for future challenges?
Joe, you mentioned one, and that was, I think you said your BCP didn't work necessarily. You didn't have a second location to go to, and we've seen that with many of our clients. They've got a BCP, they dusted it off when this crisis happened and really wasn't fit for purpose. So I think there's I would say there's a learning there around being better prepared. Whether you accept or not, there'll be more of these types of global events. I think we all realize that we need to be better prepared. And one of the questions that it came up from on the Q&A is, and this is a kind of interesting question, is what does all this mean for the demand for office space? So if more people are working from home, people are working more flexibly, that suggests less demand for office space. But of course, when we're back in that workplace, it's going to be configured differently. We won't be crammed in. So if I think about in Asia, for example, there's been densities have been squeezed out of office spaces for many years. So that's not going to be the case in the future. That's not going to be acceptable by our employees. So I think that will offset that any potential reduction in demand, and that. But I think we'll be thinking about the workplace again. We'll be thinking about what's the purpose of the workplace. What is the purpose of coming together? And I think that's all part of the reimagining process. But I don't necessarily expect to see a big reduction in office space.
Yeah, Cameron, I would completely agree. I think that there might be an initial reaction for people to say, hey, this worked fine. Why do we need all this office space? But as someone who's worked at home for many years and worked in an office, I see both sides of it. I think exactly what you say. I think the reaction that we're going to see when people come back to say, hey, I need a little more space here, especially in intensifications that we've had over the last 5-8 years, we're going to see that probably offset. So I don't think that that's going to be a big change. I will say that the father of 2 millennials, I think the PTO, paid time off thing, is going to change. It has to change, because I know that many people historically come to work if they're not feeling 100%, because they don't want to give up that valuable PTO day for their Hawaiian vacation, coming up. And I think that that's going to have to change corporately and at a lot of different levels to say, if you're not feeling well, you stay home and it'll be okay. We're not going to dock you. I think we have to get to that where people don't feel like they have to trade their health or other people's health for that valuable PTO day. And that's a discussion we're having in our senior team here. And again, I also agree with you. We are very big business continuity plan people. We demand firms like yours, JLL, who manage a lot of properties for us, that you have a business continuity plan, because we need to know that you're still on the ground managing properties for us and still doing that. We can't do it here from San Antonio. So I think we were ahead of the game. I know a lot of companies that didn't even know what BCP meant, fairly decent sized companies that never, they don't live in California where they have earthquakes. They don't live in other places. They take for granted that the power's always on. They can always get to work. I think you have to start thinking differently as a company, large or small, as to, if I wake up in the morning and the world is different, what do I do? And that, I think, is going to be a good thing, because pragmatism always wins when you think, not doomsday, but when you think about what could happen and you're ready for it, you tend to do better for yourself and for your employees. I think we did a great favor for our employees by being ready for this and helping them get through it so that they could feel productive, feel cared about, and feel supported.
Great.
I would sort of take the PTO conversation one step further, and I think it's beyond this industry necessarily with the buildings, but I'm hoping that we learn our lesson sort of from how other countries have handled this, that there's some people who don't have PTO and that were forced to choose between feeding their children or being safe and like staying home and social distancing. And I know there are great portions of our populations that don't have that choice. So hopefully this is, a lesson for another conversation for that as well. But in terms of the building and design industry, we were already suffering from so many woes that we were trying to be innovative and flexible about, and that has to do with sort of lack of skilled labor, the cost of construction skyrocketing, lack of affordable housing that are that's a concern across the country that really directly is correlated with the health outcomes for what's going on here. So across the industry and with our focus, we're looking at different ways, like I said, to deliver construction that addresses those dynamics that are actually just going to get worse and are going to be quite exacerbated by what's going on with the pandemic. So really, we're going to be having to sharpen our pencils more and engage in more conversations globally about the prospect of modular housing and modular construction and manufacturing to help to be creative to solve some of these issues.
So just one more comment on this, picking up on the generational comment that was made, and then Jenny mentioning the creativity piece. I think it's a wonderful opportunity for this newfound autonomy that our teams are having as they manage, you know, and direct and lead and are part of teams virtually, to find their own leadership and to really advance that and to be at the ready. Because honestly, in the mid-career portion of our AEC industry, there's a real opportunity for leaderships to step in and up and to move into places that maybe people wouldn't have been so bold before to do. And really looking at that, because I know the management and direction within hospitals, within firms, within various parts of our industry could really use that. So I'm excited to see what happens 3 to 6 months from now when all of this new on-the-fly learning has happened and people come out of it ready to make this transformation.
Excellent. We have quite a few questions to get to, so let's close with the question that I think we're all asking. Where do we go from here, and are there any words of advice that you can offer to your fellow industry professionals? Joe, why don't we start with you?
Okay, there we go. I pushed the wrong button. I sat down with my team that ranges from 24 to more mature, let's put it that way. And I just said, look, this is the 4th recession I've been through in my career, and I've weathered all of them reasonably well. You know, emotionally, physically, financially, you can get through these things. And I really like Brenda's comment about, you know, kind of find your own leadership. I'm actually gonna think about that with my team. Is like, you know, they look to people in organizations and families and whatnot for leadership. What do I do? What do I do? And I think my message going back to my team, and I think I'd like to share here, is what Brent said: find your own leadership. Right now, you lead a team of 1. You sitting at your desk, your dining room table, your kitchen counter, wherever you are, and leaders like myself and the others here are counting on you to get up in the morning and lead yourself and decide what's important to do and move forward, and hopefully come back to the office, come back to wherever you work with a really good sense of who you are and what you're capable of. And I've found all the economic downturns, and I lived in California 2 miles from the epicenter of the Northridge earthquake, which was a very interesting experience. But every time, a year, 2 years, 3 years later, when I looked back, you know, I grew, my family grew emotionally, we closer. I know I'm talking to my brother and sister more than I normally do, and we're close. I just want people to feel like, look, you can grow during this time. It's not a time to shrink back. It's a time to grow personally. And I'm really excited to see my team come back to the office, not needing me as much, and being more self-sufficient and becoming better leaders. So I'm really trying to look forward to that. And so that's the message I would send out to everybody.
Great. Jenny?
So early on, a lot of us made a decision to work from home, and that was clear. But what I decided to do was not cancel anything. Whatever appointments I had on my calendar, figure out ways to stay connected and leverage all sorts of software. We use Slack in our office and Microsoft Teams for that sort of daily kind of you can't turn your head and ask a question, but you can ping somebody in those formats and save those conversations. So I think that we cannot forget the sort of humanity of what's happening, and that we're all under this heightened level of anxiety. And so keeping connected on a human level, not only for business purposes, makes a ton of sense just as people. And I appreciate what Joe's saying too, because my family, I come from a family of 5 siblings, and we have a rotating call to our parents to make sure that someone's in touch with them at least once a day to make sure that they're behaving. But just having ways to continue our lives, like our lives don't stop, and they just are continuing in a different way. And that's something that we could fully embrace.
Well, I'd like Jenny to call my parents also then, please. Jenny, if you could do that.
I got my parents on Zoom too, so I'll set aside 3 hours for that.
Yeah, I'd just add to all of that. I mean, I think leadership's incredibly important, and it's really an opportunity to show leadership during this crisis. But to add to that, I think it's important to preserve business relationships, relationships with our workforce, with our clients and our supply chain, and also to be empathetic during this crisis. It is tough times for a lot of people. And I think we just need to recognise that and be empathetic around that. And the last thing I'll leave you with is a Chinese expression, which is when the wind is blowing, some people build shelters and others build windmills. I think that's the creative, open piece around, yep, we need to defend the citadel, but it's also an opportunity to change things for the better.
And I would just say, you know, show compassion, lead with your heart, and the business will follow. No question.
Let's move on to the Q&A portion now. We've got quite a few questions, so we'll get to as many as we can. The first question is for the designers on the panel. What are some of the safety measures for compromised areas that you can provide?
I'm not sure what they necessarily mean by compromised areas, but I do know that what's coming out of the Army Corps of Engineers is that we need to do as best we can kind of solution right now. So there are things that are sort of not done that we would normally do in the sort of long-term built environment, but there are guidelines that they have put out to, that should be followed strictly. So I'm a big fan of going straight to the source and following science and trusting sort of the CDC and World Health Organization and getting good information on how to address breaches or evaluations of our workplaces as we go on a day-to-day. And the other thing is that it seems amazing to me that this is week 4 of work from home, and what I was doing 4 weeks ago is completely foreign to me right now. But things are changing day to day. So I would, if you can avoid some of the very depressing statistics and that kind of thing, but just stay focused on the good information, but to really be on top of the day-to-day changes, that's really critical.
And just to add in, if you mean compromised spaces as in there could be COVID patients or infection, very tactically lean on environmental specialists to go in and do those assessments. They are trained, they are smart, and they will tell you in an unbiased way exactly what needs to happen for safety.
Excellent. The next couple questions are on working from home. One viewer asks, will the working at home period lead to the demand for downsized spaces, and how will the CRE industry adapt to that? And another viewer asks, do you feel social distancing and work from home will lead to a certain percentage of companies continuing to leave employees at home long term?
That's a good question. We saw in the last 10 years companies try the work from home thing, and most of them have pulled a lot of people back. I have friends and relatives who, oh yeah, I work from home. In 2-3 years, they realize productivity drops, and it's hard to manage people. As someone who 3 years ago worked from home for 5 or 6 years, it takes an incredible amount of discipline to work at home. You have to have a separate space. You have to, I remember when I worked from home, I literally had to look at my wife and kids and the dogs and say, I'm going to work now, which meant I'm going upstairs. Don't ask me to go to the grocery store. I am not going to respond unless there's smoke or fire. I'm not here. And it took a lot from the family and from myself, a lot of discipline. So while I think that people are going to come back, I think people are going to want to come back. There's probably going to be 10% of people that are going to raise their hands. I'm expecting it here to say, look, I'm just not comfortable. I want to work at home. We haven't had that discussion yet officially. Unofficially, we've had that discussion, and each of us department heads have said, look, you can manage to that individually, but that's not going to be a mandate, at least for our firm. And again, I think what Cameron was saying, I'm not sure we're going to there's going to be an overreaction one way or another to this in the short term. Will we prove that it can work? Yeah, it absolutely can work. There's no question about it with technology and everything else. It's a function of, is that how we really want to work? Is separated from each other without the social interaction. I was talking to my team and said, I miss walking to somebody's office to ask a question and learning something on the way back in an unrelated conversation, and I miss that, and I hope more people miss that and want to get back to the office environment, which is a constant learning environment.
Yeah, if I could just quickly add to that, I think work from home is only one aspect of more flexible work arrangements. I think we'll see more flexibility there. And Joe, you talked about employers providing that to their employees, and I think that's really what's all about. The technology enables it. I think people still want to get back and have those interactions at the workplace, and they do miss not having them, just like we miss not being able to have personal interactions with social distancing, and we just make do with Zoom, etc. So I think it's more about flexibility, I think, rather than just the specific issue of working from home.
I think we have time for one more question. Looking back at your industries or your companies pre-pandemic, what components do you think you had in place that helped you adapt here now during the current time?
Well, as I said, I think our business continuity plan that was real was a great foundation for us to then just switch gears to a different form of it. Without that, I think we would have been scrambling substantially.
And I'll add a quick one is, in the lead up to this crisis, we did a transformation of the business where we became a much more globally structured business. I think that's definitely helped us and is helping us through this.
And I had mentioned it before. Oh, go ahead.
I think the trusted relationships are absolutely key. And as mentioned, those happen because you're with people in work environments and they sort of happen over time. So that was absolutely key. And the other thing is really strong initiatives that we were going to take into 2020 and just said immediately which ones we were going to elevate and make happen in a couple of weeks and serve our client organizations in an immediate way. So having a plan.
And I had mentioned just before that we had been transitioning to the cloud for a while. And so we had the benefit of being ready to do that and to be flexible, but also the way that we communicate in our environment, having the structure of check-ins and cascading messages from our leadership, that sort of structure was already in place so that information sharing was pretty fluid and established already. So we're still continuing those kind of ways of communicating with each other, whether it's local or digitally.
Well, everyone, thank you for a great discussion and for some invaluable information. Before we close out this presentation, there are just a few more important pieces of information that we'd like to share with you. Please note the number of resources that are available on this topic. Buildings has been covering the pandemic, and we've also included resources here from BOMA, IFMA, and IREM. We are all in this together. Don't forget that you can find our past courses including the on-demand version of this discussion on our website, available for you to view at any time. We have dozens of building-related topics, so please visit our on-demand courses today and watch now. Be sure to stay connected to buildings by visiting us on Facebook, Twitter, and LinkedIn. And once again, I'd like to thank our sponsors, Chicago Faucets and Powering America. Please visit their websites. Thank you again to our speakers, and thanks to all of you for joining us today. You'll now be redirected to the building site where you can view other educational courses offering ideas and solutions for your everyday problems, as well as submit for your continuing education credits. Stay healthy and safe, and we'll see you again soon.
Thanks, everybody.
Thank you. Take care.